Hello, everyone. My name is Leena Inamdar. As Dr. Hira mentioned, I'm a public health physician currently working in global health for health system strengthening in low and middle income countries, and currently working on a international health strengthening regulations program at Public Health England. My talk represents my personal views based on international evidence and not of my organization. I've been invited to talk on personal and institutional prevention and protection measures. So, at the outset, I would like to highlight that different countries are currently in different phases of the pandemic response. So everyone should follow their own country national current guidelines. What I will aim to do in my presentation is to cover the main principles in terms of prevention and protection measures, but each country has developed its own guidance based on how the epidemic is progressing in their country, its population and system. So it's necessary we follow our own national guidance. I just wanted to highlight at the moment with this slide how the world, we are all currently facing a battle against the unknown and invisible enemy. And this enemy does not respect any border or hierarchy. And unfortunately, it has exposed tremendous fragilities in our systems, whether we're talking of developing countries or developed countries. Since a large proportion of the audience is from Global South, just to highlight key issues which are common to the Global South during the COVID-19 response. Now, first wave of the COVID-19 pandemic, it may be receding in some parts of Western Europe, East Asia, or North America, but it is rapidly taking off in Latin America, Africa, and South Asia. And some of the countries in these low middle income country regions are experiencing spiraling infections, hospitalizations, and deaths. Owing to a lack of testing, it is likely that the numbers may be quite an underrepresentation of the true numbers. And the impact of COVID-19 doesn't just depend on the national preparedness, but it also depends on the state of readiness of our states and municipal corporations as well. Now, what cities like in Brazil, in Nigeria, and in India do next will not only determine the health of their residents, but in fact, it will also impact the fate of their national economies in future. And whether rich or poor, all cities are facing similar challenges as COVID-19 spreads, especially the way it impacts our underserviced populations. Many cities have experienced shortfalls in testing kits, in protective gears and medical equipments. Hospitals, clinics, ICUs are limited. So cities in these developing countries really have a triple burden, and that includes low health capacity, stark socioeconomic disparities, and also high population density that make the physical distancing measures, the shelters in place, almost virtually impossible, quite challenging to adhere to and to enforce as well. I'm going to give an overview of the prevention and protection levels at personal, institutional, and workplace level. As different world regions are now in different phases of the pandemic response, it is critical that there is clear guidance to the public, to health professionals, and to workplace employers to prevent illness and protect our citizens. And it is really imperative that everyone plays their part in fighting COVID-19, whether it is at a personal level, at an institutional or societal level. Now, in my talk, I will cover prevention and protection at the personal and institutional level, including workplaces. This will include, to a certain extent, measures at societal level. However, there is a lot more that we need to do collectively as a society to tackle COVID-19, and especially protecting the most vulnerable and deprived populations of our communities. That itself is a topic on its own, and I will not go into detail into this today. As we all know, the transmission of COVID-19 is thought to occur mainly through respiratory droplets and generated by coughing and sneezing and through contact with contaminated surfaces. So it is key that the prevention measures are mainly centered around interrupting transmission through these routes by breaking the chain of transmission. So let me begin with measures at a personal level. We all need to think about what is it that as an individual we can do to play our part in this fight. So measures to protect yourself and others. There are three key areas that we need to pay attention to for protecting ourselves our family, and those around us in the wider community. And these measures are, we all know about the social distancing measures, so I'm not going to repeat all of them, but it's really important to try and minimize contact outside our home as much as possible. If people develop symptoms, they need to immediately self-isolate for at least 7 days or until they recover. And the key thing is to protect the clinically vulnerable people, because we know there are some population groups in our societies that are at more risk of severe disease from COVID-19. So we need to protect them the most. And we need to maintain the social distance when we go out. We need to pay particular attention to the personal and protective measures and hygiene measures. So that includes obviously having a good respiratory hygiene, hand hygiene, and making sure that there are obviously, um, certain guidelines which each country will obviously issue for their own national sort of citizens. But we need to adhere to these and make sure that we wash our hands regularly, at least for 20 seconds with soap and water, or use hand sanitizer when that is not possible. The other thing is to consider use of face coverings in enclosed spaces where social distancing isn't possible. And we will touch upon that in a minute. And the last measures are environmental measures. So basically frequently cleaning the surfaces which are common contact surfaces, minimizing sharing objects with others, and ensuring there's adequate ventilation in enclosed spaces. So I just wanted to highlight and signpost some of the resources that are available freely for everybody on the WHO websites, which also include measures in terms of advice in terms of how you protect yourself, how you protect others from getting sick, what to do if I am going to the grocery shop, and how do I keep myself and others safe, and how do I greet others if I do have to go out, what etiquette should I follow. So just a quick note on face coverings. Dr. Hira has already mentioned this at the very start of his presentation. In some countries, masks or face coverings are worn as part of local customs or advised by national authorities in the current context of COVID-19. And in this situation, it's best to follow whatever best practices are given by our national authorities on how to wear, remove, and dispose or reuse cloth face coverings. And it's also very important to practice good hygiene before and after removal. I think I would really like to stress that face coverings do not replace social distancing measures. So we all need to practice all of the advice in addition to considering use of face coverings when we think that we will be in a position where social distancing may not be able to be adhered to. And in decision making on advice on face coverings for the community, there are some key considerations that we all need to be aware of that governments have had to take into account when issuing advice. What is the purpose of wearing a face covering in the in the community for the public? Is it for source control, that is for infected people, or is it for prevention, that is for healthy persons? What's the risk of exposure in our current context in the local economy? So that is dependent on the epidemic in each country, in each local setting, and how it is progressing. What's the vulnerability of the population groups? Are there certain groups more susceptible? Also the settings, what's the population density like? In some crowded areas, it's impossible often to maintain that social distancing. So then that may be a consideration. The feasibility, of course, the availability, the cost and tolerability of individuals, and then the type of coverings, like whether we are talking of medical or non-medical masks. So these decisions have to be taken into account based on these key considerations. I will now move on to the institutional and workplace measures. And for the purpose of this presentation, I have categorized this as measures in health and social care settings, in workplace and industry, educational settings focusing on schools, and public transport operators. Now, we know that the way COVID-19 has affected workplaces is increased absenteeism, change in the pattern of commerce, and interrupted supply and delivery. And based on the pandemic phases, as countries are reviewing their lockdown measures and developing recovery plans and roadmaps to opening the economy, there are several considerations to take into account as we aim to get the workforce back into workplaces at the appropriate time. So what you can see here is the occupational risk pyramid for COVID-19. Now, this slide shows 4 categories of risk, which are very high, high, medium, or lower risk. Now, very high risk is mainly for healthcare workers who will come into contact with known or suspected COVID-19 cases. The high risk is for those who are in delivery and support functions who will also come into contact with known or suspected COVID-19 cases. The medium risk workers are those who are key workers who are obviously essential to maintain our economies, but they are likely to be in contact with possibly infected cases who are not yet known or confirmed. And the lower risk occupations, where it is unlikely that there's minimal occupational risk, perhaps solo workers who are unlikely to be in contact with other known or infected cases or indeed other people. This slide I wanted to show because this is a thread that is going through the presentation in terms of hierarchy of control measures. And this is the fundamental method of protecting workers. Now, traditionally, hierarchy of controls has been used as a method to determine how to implement feasible and effective control solutions. And these are elimination, that's physically removing the hazard, substitution, so replace the hazard, engineering controls, so we isolate people from the hazard, administrative controls, so we change the way people work, or personal protective equipment. Now, the idea behind this hierarchy is that the control measures at the top of the graphic, they are potentially more effective and protective than those at the bottom. However, these are also difficult to implement in the existing processes unless there is re-engineering of workplaces, which brings us to engineering controls. Now, these engineering controls are favored over the administrative and personal protective equipment, and they may be difficult or more costly to implement at the initial startup period, but they are perhaps more effective and cost effective in the longer term. Then we come on to the administrative controls and use of personal protective equipment. These are frequently used with existing processes where these hazards are not particularly well controlled. Now, they may be relatively inexpensive to establish, but over longer term, they can be quite costly to implement and sustain, and also may be less effective and require significant efforts by the workers to use them correctly. So I'm now going to focus on measures in healthcare setting. I will not go into the details of the infection prevention and control measures, or indeed the use of personal protective equipment in clinical settings, but I will cover the key principles of planning and risk assessment and give an overview of those measures and also signpost to certain useful references. So in terms of planning and preparedness, what do health facilities need to think of? Now, even before the pandemic happened, countries are constantly assessing their levels of preparedness under the international health regulation. And that's what my day job involves, working with selected countries to review their IHR core capacities and help improve their systems for infectious disease prevention and control. As the pandemic started to evolve globally, all countries have had to rapidly assess their preparedness as there were lots of unknowns about the virus. Preparedness at health facility level involves assessment and consideration of key different areas of planning and implementation. And that's assessment of the current capabilities at the facility level, assessment of the workforce and occupational health issues, reviewing practices, how can they sort of implement social distancing where it is possible in those facilities, working in multidisciplinary teams to plan and make sure there are measures in place such as isolation, segregation, triage, defining the engineering, administrative, and personal protective equipment for staff, and alternative arrangements. So what do we do for long-term conditions, for chronic conditions? So just very briefly, in terms of principles, I wanted to highlight that there are two basic sort of principles. There are standard infection control precautions, and there are transmission-based precautions. The standard precautions are basic infection prevention and control measures to reduce the risk of transmission of infectious agents, both from recognized and unrecognized sources. And transmission-based precautions apply when the above, that's the standard infection prevention precautions, are not sufficient. to prevent cross-infection when we have a known or suspected infectious agent. So very briefly, touching on the measures in healthcare settings, again, going back to the hierarchy of controls that I showed you earlier. So limiting the transmission of COVID-19 in healthcare settings requires a range of infection prevention and control measures that we can consider against that hierarchy of controls. And these are engineering controls, so having appropriate air handling systems, isolation facilities, improving the ventilation and physical barriers. There are administrative controls such as adequate staffing, having policies that reduce exposure, immediate triage of suspected cases, staff sickness monitoring, providing the correct PPE, providing staff training on use of PPE. Also, the third thing is safe working practices. So review our practices in the health facilities, monitor adherence to IPC practices. Are people, our staff, adhering to appropriate hand washing between patients? What are the cleaning practices? How are we communicating this with staff as well as to visitors? And lastly, the personal protective equipment based on the hazard. So those personal protective equipments, they need to be properly fitted, worn, and they need to be disposed of according to the current national guidelines. And I wanted to just signpost you to a UK resource on infection prevention and control and the use of PPE when there is sustained transmission. This covers different settings. I'm not going to go into the details. The advice will vary by country. So again, you need to make sure that the appropriate advice, taking into account local transmission and the health system, is adhered to. So I will swiftly move on to the measures in the workplace and industry. This is an interesting slide, and what it highlights is that the public health risk and the economic reality, it varies widely as we consider the restart of economy globally. So here you can see at the top the different pandemic phases from active growth to when we may be in a post-vaccine, post-herd immunity phase. And as we progress through each phase, you can see the public health risk diminishing. Now, there is variation in how policies on easing the lockdown have been developed, with some countries reopening soon after the transmission has plateaued, whereas some countries are still taking a more cautious approach and waiting for significant decline. Other considerations when we're looking at phased return, to workplaces, there are four key considerations, and basically that covers adapt. So we all need to consider what's the need of the future. How is work going to change, and what will be the needs in terms of our future sort of deliverables in a new normal. We need to accelerate. We need to think of smarter ways, alternative forms of working. We are all already heavily sort of working from home, so remote working is becoming the norm. We need to be innovative. We need to craft sort of and see how we can implement new, safer working practices and processes. And lastly, we need to give enough time to consider planning and determining the workforce re-entry and how we can protect the most vulnerable of our workforces getting back to work. So again, going back to the hierarchy of controls, and it's interesting to map the workforce journey and how to consider the transition when we are looking at developing advice for workforce to get back into work. And again, mapping these hierarchy of controls against the different phases of return, phases of the workforce journey, right from pre-entry, so getting back to the workplace, to travel to work. What do we need to consider at work? What changes, what engineering measures, what administrative controls we need to put in place? How do we handle common workplaces? How do we handle those shared areas in the workplace? And what do we do if there's an infection at workplace? What are the guidelines that the employers need to follow? So it's very important to consider all of these against the hierarchy of control measures. The key is to plan and prepare our work environments to have robust plans and to communicate them clearly with our employees. And just to finish off in terms of the workplace environments, I'm not going to go into the details of this illustration, but this shows a sample journey in an office environment, as I showed in different phases from pre-entry to at work, common spaces, etc. It does highlight the issues we noted earlier and how it will now impact the new normal at workplaces in future. And again, to highlight some resources here, there are some guidelines that the UK government has published on getting the Brits safely back to work, working safely during coronavirus. So there are several documents that have been produced to different industries. And again, various governments in different countries will be working to develop country-specific guidelines. So towards the end of my presentation, I just wanted to make sure that we also think about educational settings, and particularly with the focus on schools and mainstream schools. And again, going back to the hierarchy of control and how these should be considered when planning safer return to schools. So what do we need to think of in terms of infection prevention and control measures in educational settings? Now, again, this is a busy slide. I'm not going to read everything on the slide, but just to highlight the 5 key areas: risk assessment and health and safety assessments in terms of how we will rearrange the school environments, adapting the environment both for the teaching and non-teaching sort of environment within the school. So maybe considering smaller class sizes, maybe considering not having the common break times for everybody together, one-way circulation within the school, how can we use outdoor spaces effectively? And it's important, the third thing is the communication with everybody who is related to the school, staff, parents, pupils, what do they need to do and what actions they need to take. And infection prevention measures, of course, very important, again, to reinforce the hand hygiene, personal hygiene sort of measures in school, and to highlight that PPE is not routinely used in schools unless that's needed for somebody who is already, required to wear it as part of their routine care. And this will be perhaps extremely sort of people who have, other comorbidities or learning disabilities. And lastly, transport arrangements. It's really important to consider practicalities in terms of how parents will be dropping children to school, not crowding the common areas within, the gates near the school. So all of these measures really need to be carefully considered before school authorities, the governments can start to get kids back to school. And finally, measures for public transport operators, because as the economy start to open up, people will be starting to go out and will need to use public transport. So what are the measures and considerations for public transport operators? Now these, again, similarly going back to the hierarchy of controls, social distancing, face covering in enclosed spaces where we can't adhere to social distancing, workforce planning. So that includes also how to make sure that the workforce is educated and the travel operators are aware of what they need to do and what they should be aware of. Queues and protecting the passenger flows so that we are avoiding the crowding at any one place at any one point in time, having one-way systems, perhaps if possible avoiding face-to-face seating and supporting the vulnerable populations if they are to travel. What to do in emergency incidents, because there'll be like, overcrowding. So how do we handle that if there is an emergency incident? The advice related to cleaning of the, transport vehicles, etc. Good ventilation and communication and awareness raising. So I just wanted to show this. At the very beginning, we saw the dot map globally, how, the burden of infection of COVID-19 is spread across the world. And what you can see here is the global networks. And we know that, strong collaboration is happening across various countries globally. And this just highlights and illustrates that collaboration. So Chinese and Australian researchers made the COVID-19 genome freely available. That speeded up the vaccine hunt. So collaboration, openness is really most important for developing countries who might lack comprehensive research facilities and structures. So really, to end in summary, addressing the global challenges in vastly different local contexts require the combination of cutting-edge scientific capabilities with detailed local knowledge. And to me, this is the art in the science. And collaboration is at the heart of global science. We learn more and faster together. And really, the pandemic is underscoring the critical role of the international collaboration on frontiers of science and technology. So that's what I would like to end my presentation with. Thank you for listening.